everyone. Glad you could join us tonight. Tonight's going to be super, super special, as many of our podcasts are. But today, it's going to be really cool because I've got Dr. Wendy Besler on tonight. And my gosh, you're going to enjoy this one. So she'll talk about the use of light and the brain. And I'm sure you're going to really enjoy this webinar. So for those that don't know yet, if every time you tune in to watch one of our webinars, you get a ballot put in, and at the end of the month, which reminds me, I think we had, I'll see if I got the name yet. If not, for sure next week. I'm sorry I'm delayed. It's just that I've been on the go so much. So or maybe I did tell it. Okay, I don't know. But if we haven't given it out yet, every month we give out the one of the Palm Ultimates to somebody who comes from the random draw. And so that is a device that's $1,300. It has the two wavelengths, the 660 and the 810 nanometer wavelength. And that's a phenomenal device. We've had lots and lots of good successes with it. So yeah, and I've done a lot of traveling. I just came back from California, and we were able to be at an event where we were able to, it was a pretty big event in, it's called Conscious Life in Los Angeles. And then I was able to attend also an autism fundraising raiser, and that went extremely well, meeting some truly leaders in the health industry. So it's been a lot of traveling, but I'm glad to be back, and I'll be back here for the next few weeks. So now we're just going to go to a quick video, and then we'll come right back on and introduce Dr. Bessler.
15 years back, I realized that light could make a huge difference on the body. I ended up designing this very powerful light using LED technology. With this amount of very high power density, it can reach through the tissues and travel right to the joints. But the key is that the power density and the area is extremely important to deliver that light into that. The mitochondria receives that light and converts that energy into the cell. So it's like giving the cell super high octane fuel, and they run like a jet, and they're able to do all the things for repair in that. What are the products we have? Well, we have a small device, which is actually large when it comes to light therapy. You have a fairly large area of light and a high power density that can be used for different parts of the body, like your finger, shoulder, back, neck, knees, ankle, anywhere on the body. And then we have what's called the mini canopy, which is about a foot square in size. And then we have our full-size canopy, which is basically 6 of the mini canopies. And then we have another device, which is the helmet, and that device can help for mental issues, for brain injuries, for concussions, for PTSD, TBI, all of those kinds of things. And there's new research out there that shows it could be helpful for not only strokes, but dementia, Alzheimer's, and Parkinson's, and just different brain issues. Our plans are to move this technology into every area of the world where there's pain and inflammation, which is basically everywhere, and to expand that so people understand all the applications where this technology can be used to help them in their health in the body as a wellness device. People are looking for how they can treat themselves without drugs.
All right. So Dr. Bessler, if you'd like to get your video coming on and your audio. So Dr. Wendy Besler, she's an MD, is a medical doctor specializing in integrative neuropsychiatry with deep experience that bridges neurology, psychiatry, nutrition, and innovative brain-focused therapy. She trained as a physician assistant in neurology and went on to complete a psychiatric residency combining these disciplines to treat complex neurologic and psychiatric conditions with both conventional and cutting-edge approaches. Dr. Bessler incorporates evidence-based modalities such as photobiomodulation and red light therapies into her practice, exploring how light-based energy can support neurometabolic processes, reduce inflammation, and potentially improve mental and cognitive function. She has participated in PBM professional training and is actively engaged in educational events, webinars about red light therapy and PBM applications in neuropsychiatry. Her holistic approach emphasizes understanding brain function through multiple lenses: biological, metabolic, and functional, while applying emerging technologies like transcranial PBM to support neurologic health and well-being. Dr. Bessler, fantastic to have you on tonight. Thank you so much for taking the time to share a little bit about what you know. And the only reason I say that you'll only be able to share a little bit, we would have to extend this on till midnight to cover all the stuff that you've learned. And then the whole area of what light can do. So, how did we meet in the first place?
That's right. Well, number one, thank you so much for allowing me to do this and having me on. I am so happy to share some information with your viewers. I believe we actually met for the first time when we were in London, England, at the Walt. Yep, that big, huge Walt, which was, for everybody that doesn't know this, Walt is actually the worldwide organization for photobiomodulation therapy, and it was actually celebrating its 30th year, which is amazing because here in the United States, we know very little about photobiomodulation therapy. And there, it is absolutely accepted. It's well known. Their insurance covers many of these different modalities. And we're just trying to catch up to all of that. So I'm thankful to know you, Tom, too, because you are obviously one of the pioneers in that as well.
And it was so neat. At that event later on, you got a chance to meet Dr. Heyman Boone, and when we went outside, we learned that Dr. Florence Nightingale had a museum right across the road that talked, and she was one of the early ones adopters of light therapy, and this goes way back, in medical history, and yet it's so much unknown. But I got to say now in the last, what would be the last 2 years now, it's really starting to come out there. From where I started about 20 years ago, and nobody knew anything. It was just a few chiropractors that were really using lasers, and I got to say the dentists were the early adopters of laser work because they saw how it could help in using inside the mouth. So, and they were used to using lasers for other things in their mouth. So it wasn't too hard for them to start using the light for other issues on the mouth, just light alone. So that's how really PBM started, or red light therapy, or cold level laser therapy, or low level light therapy, or low level laser LED. There was just like and now they finally call it photobiomodulation. So, but it was thrilling to meet you there. We had done the presentation, and it was really neat. We got Dr. Margaret Naser on this podcast tonight. She's watching in, and she's really one that influenced me as well once I got to get to know her, and how the light can make a difference on the brain. And specifically, she's looked at the whole area of concussions, and what's the term for concussions over and over and over again the football players get? What's that called?
Yeah, so TBI that becomes unfortunately encephalopathy.
That's the one I was looking for.
Yeah.
Thank you. I wouldn't have been able to say that word. I need to get that word out there yet. It's got to work on it. But anyways, to have that kind of knowledge and and she was there. She talked about one of our cases with the concussions. We also at that event we had the two people Hoffer, and Jenny, Dr. Hoffer and Dr. Jenny Flora, to do with the study we just presented back then about opiate addiction and depression.
Mm, yes.
And that was fantastic. And now we've got studies that we got an Alzheimer's study that is likely going to start within a month in Texas. We've got another where we're hopeful that there's going to be another one on migraines, another one that's going to be on brain fog. So, anyways, a lot of exciting things that are happening right now. That's part with some of the travels I've been doing. But tell me a little more about you. I am so thankful. There you thought, I think I'm going to get some of this equipment from this guy by the name of Tom Kerber. And tell me what's been happening since then.
Well, it's been actually really exciting. So at my clinic, we do neurology and psychiatry, and many of the cases that we have are very, very difficult cases. By the time they get to us, they've seen numerous different practitioners. They've done a lot of standardized medicine care, and it's very, very frustrating for a lot of these different individuals. I think one of the most amazing things about PBM is, we talk about mitochondria and how it can actually increase by hitting that cytochrome C, which is that fourth complex in the mitochondria, can actually increase that ability for that mitochondria actually now to produce ATP, ATP being the energy molecule we need to do anything, right?
Right.
Including run a marathon to make sure that we don't get abnormally folded proteins in the brain. ATP is required to do that, to make sure this runs your lymphatic system, this runs cerebral blood flow. So it's amazing when you can use something as non-invasive as light therapy that literally has no negative side effects. And
Yeah.
I can use something like that to help a patient that has a stroke, traumatic brain injury, Parkinson's disease. I mean, it's really, really mind-blowing what we've seen at our clinic. I know I talked to you about this case before. I think this is a phenomenal case. We had a lady, unfortunately, with dyskinesias. These are abnormal movements all over her body from her head down that she had no control
Just
over. They were actually,
keeps.
yes, literally, it was so hard to even watch. This poor woman suffered so much, and this was caused by antipsychotic medications. And this is a permanent now with her, a permanent condition. She had tried everything underneath the sun, every medication, nothing worked, absolutely nothing. And I said, you know what? Why don't we try our helmet therapy? Why don't we try PBM, transcranial? And she said, I'll give it a shot. There were no studies or anything like that on
Yeah.
dyskinesias. There's nothing. And I said, hey, we got to try this. And we did. And to our utter amazement, after about 2 to 3 weeks, she literally lost all the dyskinesias of her upper body. She had some still left in the lower body. They were lessened significantly. This is a woman who could not sleep at night because these movements were so horrid. So to have something like that you can offer a patient that has no negative side effects is phenomenal and unbelievable.
Yeah, and what I've learned, a little bit that I've learned is that also, since we can reduce inflammation in the shoulder, we can reduce inflammation in other parts of the body. With the light, we can reduce inflammation in the brain, neuroinflammation. And
Yes.
isn't it, I learned this surprisingly as I started going along that neuroinflammation is tied into all kinds of disorders. Can you say some of the
Yes.
disorders that you're looking at when you're looking at neuroinflammation, and if you can just reduce that inflammation, what can that do?
Absolutely. So when anyone thinks of inflammation, it's one thing when you bang your knee and your knee gets really, really big, right? Because it gets inflamed and it's angry at you. The exact same thing happens in your brain. It's just you're not going to be aware of it like you would your knee. Instead, in the brain, when we get these inflammatory cytokines that actually can cause neurons to malfunction. But more importantly, it is actually usually mitochondrial dysfunction that actually is the underlying piece of the puzzle to that
Okay,
inflammation.
so explain that then further.
Yeah. So when we're looking at mitochondria, and this is so incredibly interesting to me, obviously I need to get a life, but when you look at mitochondria, we were convinced for years in medicine that mitochondria were just in cells, and that's the only place they were. And these are the energy workhorses of every cell in your body. And then we found out, no, mitochondria are free floating in your blood. They are not housed inside a cell. They can go anywhere they would like. And that's what makes PBM even more special. So when it comes to inflammation, remember these little mitochondria have what's called an electron transport chain, and they have different complexes 1, 2, 3, 4. And after 4, we spit out ATP, the energy molecule that we need to do all of these functions that we do on a
Right.
normal daily basis. Now, if all of a sudden that particular mitochondria, let's say it gets kind of hosed. It's not working very well anymore. Maybe because it's older, maybe because it hasn't gotten the right nutrients for whatever reason. All of a sudden now, it's not allowing 36 ATP to be produced. Maybe now all I can get out is 2. That is going to cause a inflammatory cascade and can in the brain, because when that happens, literally mitochondria almost send out signals that they need help. They're in trouble. Then I get an increase in these different kinds of mechanisms, including something called like IL-6, which is an interleukin that we know has access to the brain and that will increase when there is inflammation. So when all of a sudden I have all of these different factors that are increased, this inflammation is there. Well, how do I deal with that inflammation? And what can that inflammation cause?
Right.
And we now know that inflammation causes neurodegenerative diseases. And when I say neurodegenerative diseases, I am not just talking about Parkinson's disease, Lewy body disease, dementia, primary progressive aphasia. All of those are neurodegenerative diseases. So is schizophrenia. So now we have information that bipolar is. These are diseases that are affecting the brain and that cause long-term damage. I'm losing brain cells. I'm losing size. Yes, Alzheimer's disease, dementia, vascular disease, dementia. All of these are neurodegenerative diseases that are responding to inflammation in the brain.
Okay. And
So,
what can we do if we turn
yeah.
that around? What can happen?
Well, the question is, what can't we do if we can turn that around, right? So that's the most exciting part. So now we'll go back to that beautiful mitochondria. Now this guy isn't working so hot. So there's something very specific in that mitochondria. Complex 4 is cytochrome C. Some people kind of call it our leftover plant stuff. It's almost like chlorophyll left over from a plant. Plants need light to survive. They can't survive without it. Guess what? So do we. We are the same exact thing. So cytochrome C actually responds to a specific nanometer spectrum of light,
Yeah.
and it has the ability to literally turn that back on and allow that mitochondria now to again produce 36 ATP and get my brain out of the hole.
Right. Right. And this is what we've seen. And it's amazing to see even very quick response on some things, like immediate response. Mention a little bit about what you've learned with autism and how this might connect, and then I'll finish up. I didn't prep you with this question or anything.
That's okay.
I haven't prepped you with any questions. I'm just letting it
That's
go.
okay. This is my favorite stuff to talk about. So especially with, autism. So there is a lot of hypothesis right now that there is something called the default mode network in the brain, that there may be not functioning appropriately with autistic patients. That default mode network is kind of the automatic network of the brain. It's kind of like the guy in the background that's always telling everybody what to do, when to be quiet, when not to. So it's an incredibly important network. And we now know that there's been some studies on autism with PBM that look incredibly promising, because utilizing that default mode network specifically with autistic patients, they've had improvements in cognition, in behaviors, and in mood,
Yeah.
which are all phenomenal. And if you think about this, all of these are increasing cerebral blood flow. We know that PBM increases cerebral
Yeah.
blood flow. Again, that's mind blowing, right?
Anywhere in the brain, in
Correct.
parts of the body, diabetic foot ulcers that won't
It's
heal,
amazing.
anywhere we can help with blood flow with the light therapy. So it really does have an effect, any cell on anywhere in the body. And what was the one moment in my mind that connected a dot a little while, it wasn't very long ago, was one person that's coming in, caregiver that's bringing in a fellow that's very dysregulated, a young man. I think he's 18. And so he has a lot of difficulties. He's always on the go, and he's very much to handle. And apparently, he came in the one day with the caregiver, and the caregiver said, "Oh, I'm so glad we made it today because there's a storm coming on." And I'm like, it just like the moment, the dawn of,
Yep.
whoa, I just learned something. And, like when people who have inflammation in other parts of their body, their knees, their, ankles, their shoulders, they will notice, and even people with migraines, right? They will
100%.
notice that the pressure is changing. You go into a low pressure area, like the atmospheric pressure reduces. When atmospheric pressure reduces for a storm that's coming on, anybody who has inflammation will increase, that inflammation will increase. And so in the case, and it just dawned on me that this young fellow was like having a lot of difficulty because he's on the edge of inflammation all the time.
100%.
And
Yes.
when and a storm comes along and it takes him over the edge, and he said, as soon as he got the light treatment, we're talking 4 minutes.
Yeah.
He says he's back to somebody I can handle.
Yeah. Yeah.
In
And that's what it can do for the human brain. So when we look at this, and just if we even ignore all the great improved ATP and mitochondrial function and increased oxygen availability that it causes, just focusing on the increase in cerebral blood flow, just focusing on that. There was a phenomenal study actually that was done with transcranial PBM that they actually did on females, but this was the best. They used to actually look and gauge it. They used transcranial Dopplers, which are ultrasound. So an ultrasound is really good at showing me how fast the velocity of the blood flow that's going through the brain. When these people used PBM, and this was a group of women, actually they were older women, literally in the left MCA, they had an increase of 25% in blood
wow.
flow. The basilar artery, 30% increase in blood flow. Now, I know maybe 30% might not sound like a lot to somebody, but with someone who has a brain injury, 30% is the difference of being able to think or not think.
Yeah.
That is huge.
Yeah. Yeah, it was just thrilling to see that happen. And more recently, we're going to continue to hear some of your cases, but I had really something exciting I was able to share with you guys is is a young girl that had up to 56 seizures a day. And I won't go into the full detail of it, but under drugs, and this is a young girl, and under drugs they were able to drop the number of seizures down, but she still had 10 to 15 seizures. And I realize this is very early in the response, so we'll have to see how she continues. But in the first time over the last 4 years, she was able to go through just one short seizure a day almost, like on average, over the past week. Going from, and the seizures that she had were much longer, and now they're much, much shorter. So to go from, what do you think, going from, 10, 15 seizures a day to one, how does that sound to you?
Yeah, it's that's in medicine, that's considered utterly amazing. And now, if this was a drug that did this, this would be the most popular drug out there for seizure control, right? But because it's coming from not a drug, we're actually talking about something that has a tremendous amount of physiologic basis that you can actually wrap your hands around to go, okay, what happened to that young lady? Oh, all right, I got improved mitochondrial function, right? Because of the light therapy, I got an improvement in her ATP production, which means now I have more control over one neuron firing off and talking to that other neuron. We know that seizure disorders, literally, it's a neuron in a simplistic way. It's kind of a neuron that goes awry and starts to overfire, then confuses the neuron next to it, then confuses the neuron next
Oh,
to
is
it.
that what it is? Okay. Or
And before you know it, if it goes over the entire brain, now I've had a grand mal seizure. Most likely I'm having loss of consciousness. All of those things. Now, if we can come in and use something as simple as PBM to actually increase cerebral blood flow, to get better mitochondrial functioning, to get increased ATP. Oh, by the way, we also know that PBM actually allows clearance, better clearance of the lymphatic system, which is the
right,
lymphatic system of the
right.
brain. So
Yeah.
if I now can even clean up free radical damage and I can be more effective at that, how can that not help the human brain?
Right. I just, another colleague was telling me about all of the toxins that are floating around in our body that end up in the brain. Like nowhere, in no time in history have we ever been assaulted by as many toxins as we have in the last 50, 100 years. And especially all the microplastics that are floating around. We have a barrage of things hitting our whole body. And the challenge with the brain is to clear it out. How do you clear it out? How does the body, it's fighting to try and clear it out. Well, if anything that can help the lymphatic system to work better in other parts of the body, to drain the inflammation from your shoulder. So now your shoulder can work, or drain it from the knee, and now you can move the whole range of motion. We don't have any mechanical movement up here. Well, maybe some people might think I'm a little bit crazy up there, but and maybe there is some mechanical, I don't know. But anyways, to be able to clear out the junk that we have been assaulted with for the last how many years, with light. It's huge. So we're not only helping these other parts of the electron chain transport to work properly, but we're also helping the body to start clearing out some of the junk that's been stored for years in the brain. So speak to the area of dementia. That's one that a lot of people ask or have asked, and we've seen some Lewy body dementia. If people want to search back in my videos, I had a fellow that was he was a very good friend of mine who was having a rough time, and he gets on the interview, and he, after 2 months of using the light, and he's like, he couldn't put sentences together, and there was other challenges, And he comes on my podcast, and he says everybody should think of using one of these lights because there's no problems with it, and it helps with this and it helps with that. And he's going down the list, And here's a guy that was having a lot of challenges. Somebody else that I know that's early onset dementia used it for 5 weeks, wasn't too sure of how beneficial it was, wasn't thinking that way, thought it seemed to be some good things, but then gave the helmet back and wanted the helmet back again because he lost a lot of good ground that he had that he was having. And so he's been able to get the light back again. And so we've been able to see this cognitive improvement in that. The one fellow, I'll just refer to his first name, David, severe stuttering problem, and since a child, so all his life. Now his knowledge and his ability to think science as in biology and chemistry and all that. I mean, he's so sharp. His work was presented in front of the U.S. Senate. This is a smart cookie. But my gosh, if you ever wanted to be with him, you'd want to help him finish every sentence because it was so difficult for him, especially if he got under pressure. Any extra pressure would make it worse. Well, before Christmas, for about 2 months, he used the helmet, and he improved so dramatically that he was able to do a podcast and get through it almost without stuttering. And everybody's like, "What happened to you?" kind of thing. Well, I'm doing this light therapy thing. And then Christmas, New Year's, he took it easy. And he said it was okay for me to share this. So he says he kind of thought, and come January, he was back in here because he might have to use this for the rest of his life, to be on top of this. But he lost that ground and he's reclaimed it now once again by being under the light. So tell me of some other cases that you've seen.
Oh, absolutely. So, and I think everything that you're saying, and just so the audience knows too, we're talking about these individuals and they get better with the light therapy, and then they stop the light therapy and they degrade. They have seen that in study after study after study. And you have to go, okay, so what is the long-term haul with this? Well, we also know that there's long-term effects of the light therapy that we know. One of the studies that I was just reading the other day, I thought it was phenomenal. They had found 14 different transcription factors that were actually upregulated with PBM. Now, these transcription factors, these signaling mediators, also are what cause an increase in brain-derived neurotrophic factor, BDNF. BDNF is the stuff that all of our brains have, that when BDNF increases, it causes neurogenesis and synaptogenesis, which is the making of new neurons and one neuron being able to synapse, hook up with another neuron. And that, I think, is what we're really seeing in those dementia cases, where, yes, we're seeing anti-inflammation, we're seeing better ATP, but we're also seeing an upregulation in BDNF, brain-derived
So
neurotrophic
over
factor.
time, we could see some improvement, not just
Absolutely. Absolutely. And that's why I have one dementia case that she has vascular dementia. And unfortunately, she's relatively young. She's in her mid-60s. And husband was very concerned, brought her in. They had done all of the standardized medicine care. Nothing, of course, had worked. She was slowly degrading to the point where she could no longer do laundry. She could no longer prepare food. And it was heartbreaking. And one of the very first things we did was we introduced the helmet therapy. And it was so successful that they actually got a helmet of their own, because there's 3 hours for me. So traveling back and forth was just not feasible. Right. So they got their helmet, and I just told them, how to use it, exactly how many times to use it. The most amazing thing, I had just seen them, I think it was last Saturday, to hear, and this might not sound all that in a bag of chips to a lot of people, but this is over the edge. When you have vascular dementia, she is now doing laundry. She's folding the laundry. she's putting the laundry away.
My wife
Yes.
would just hope that I could do enough light therapy to make that kind of effect on me.
I love it. I love it. Yeah. I wish I could do that with my husband too, but unfortunately,
no,
so
but for somebody with dementia, that's huge to be able to do
it was
something
amazing.
again, do something again, and even to the point of loving it. We've got one of the Parkinson's. We have videos of and one of a lot of videos on the YouTube. Please go to the SunPower LED YouTube channel and please like subscribe and like. But one of the individuals was not telling, it was not the blank face, no
Spaces.
reactions
Yep.
anymore.
Yep.
That was if there was people around, he'd just sit in the corner like a stump on the on the ground and nothing happening. And he started doing the light treatment, and within a month's time, his wife had said, well, within a few weeks' time, as my wife had said, the first time he smiled at me in years. And,
Oh,
that was the first thing. Then he was able to regain his taste and smell. That came back to him. And he hadn't had that for like 5 years or something to that. And now you taste and smell. He started gaining weight because he started eating food and loving eating food again. The funny part was he said he could they're in a very rural area where they spread the manure, and he couldn't smell there was no sense of that at all. And then all of a sudden he started smelling the manure as it was the farmers had used, and so all of those kinds of things came, were coming. Well, even walking, he was able to have better stance and not be as tired at the end of doing a short walk. He'd have to lay down for an hour. All these kinds of things were unfolding as he's doing more and more light treatments. And I remember cracking a joke, and since every once in a while we got to lighten up around here, so this joke is these two seniors. Now remember, this is a fellow that had no
mass
cognition
spaces.
of
Yep.
not being able to laugh or think of something funny or anything like that. So this is after now 2 months of light treatment, and I said I heard this joke and I love it. The two senior couples are in a car, and of course the guys are in the front and the women are in the back. And the driver says, "Hey Jim, what's the name of the restaurant we're going to?" He says, "I don't know." "Come on, Jim, help me out. I don't know where we're going." He says, "I don't know." He says, "Come on. You know a street?" "No." "Okay. Hmm. What's the name of that flower with the pokey things on it?" And Jim says, "What do you mean?" He says, "Well, they get the little sharp things that you can poke your fingers on." "Well, it's got the red petals on it, Jim. Come on, help me out." Oh, like a rose?" "Yeah. Hey, Rose, what's the name of the restaurant we're going to?" So, and he just broke out in the biggest laugh. And it's so neat to see when people have their life come back, to them.
100%. I think my Parkinson's patients are very, very close to my heart. We have quite a few Parkinson's patients at my clinic. That is one of our most amazing breakthroughs with one of our Parkinson's patients. She was using the helmet. She was actually a lawyer, and she had to stop working because the Parkinson's disease had gotten so bad. She started the light therapy. She was very, very initially she wasn't that crazy about it. She went, "What is this? How is this possibly going to work?" And then as she saw benefits, we got better motor skills.
Hmm.
All of a sudden, my coordination got a little bit better. Now I've got less tremor. She excuse me, she actually went back to work. She's able to go back to work, and was able to retire the way she wanted to. The very, very best out of this, though, is that with Parkinson's disease, we use levodopa, carbidopa, also known as Sinemet. That's the main drug that we use to control the movements. You never see a Parkinson's disease patient that goes down on their Sinemet. That doesn't happen. It's always constantly being increased. She was actually able to go down on her dosing of Sinemet. She only now utilizes it twice daily instead of 3 times daily, which is very, very unheard of. So that was one of the biggest breakthroughs, I think, for us, in seeing that response in one of our patients. When we can actually decrease medications, that's off the charts.
Yeah. Oh, well, speaking of decreasing medication, we have another video that we did an interview of a fellow who was a PTSD war vet, and there was a chemical explosion. So it's possible to search all these different videos on our SunPower LED, even our website. You can find it there. So this fellow, he had a severe PTSD, and I guess when that drives you crazy enough, you're willing to do even more crazy things. So he went from that to being after they discharged him from the army, he went to being an MMA fighter. Like, okay, do you want to make things any worse? Get beat the head to a pulp and see if that helps your brainwaves any. So he said after he was doing that, he was on all sorts of drugs. He says the depression was so bad, the anxiety was so bad, and he says I just didn't want to go out anywhere, and heavy on the medication. And he found out about the helmet, and also about methylene blue. There's a website, methyleneblue.red. Okay, there's some interesting information there. But he did combination therapy with that, and he's off all medication, and he calls it the happy helmet. So this guy here, is the helmet that we're talking about. So this just comes down like this. And Wendy has one of those in her office. And there's the bright red 660 nanometer and the 810 nanometer wavelength. Now this one, you don't really see, you see some little pinkish dots here. You don't see it, but it's actually penetrating much deeper. We also have the 1050 version as well. But anyways, he bought one of the helmets and is using it on a daily basis, and is so thrilled because he says he's off all medication. He calls that the happy helmet. He no longer has depression. He no longer has that anxiety. And he says, I feel like a brand new person. I'm excited to have life again. And
Phenomenal. And that's why we do what we do, right? Because you want to see that response in a patient.
yeah,
Having just constantly giving, a patient medication after medication, most of the time you don't see that positive response. And I wind up with a lot of side effects. But when we can use something that has no side effects and I can get these positive responses. I had one patient, a young girl, in her 30s, and she was suicidal, horribly suicidal, to the point they were talking about doing something called ECT, which is electroconvulsive therapy, which is where basically you
yeah,
induce a seizure upon the patient. It is very, very difficult on the brain, to say the least. And I said, you know what? Let me try this helmet therapy first. Let me try this first. She actually did. And I said, you have to be willing to do this for 12 weeks, because
okay.
every study really indicates 12 weeks is my sweet spot. So that's what we did. And after 12 weeks, she no longer needed half of the medications that she was on, and she no longer had suicidal ideations.
Yeah. That's just beautiful. And just to set the record straight, I'm not a medical doctor to anybody out there, and any good questions could be passed along. We'll pass them along if you would like to. to email us, and I'm sure Dr. Bessler would love to have a look, try and answer a question or two. Yeah, I can't recommend, but one thing would be anytime you're doing therapies like this is to come off the medication extremely slow under the guidance of a doctor, because yeah, it's beautiful to come off medication, but you better do that really slow. Right? Not a
Yeah, unfortunately, all of the medications, especially in neuropsychiatry that we use, none of them really you can go off abruptly. All of them have to be slowly weaned off, so that we don't run into side effects and rebound and all the other things that can happen. But it's again, it's amazing when you can actually utilize an increase in mitochondrial function to get that increase in ATP. So now I'm cleaning up more free radical damage. I can do more repair work, especially in the lymphatic system when you sleep at night, which is when the only time the lymphatic system of the brain is actually activated. That makes a huge difference. And that's really, I think, where patients really see their response.
Here's another one to share with our group here, and I'm not sure. I don't think I didn't get a chance to talk to you about it, but we have and they've said we can share this now, so I'll share it. But in Grand Prairie, Texas, the police department and special services and that they have fire too and that and. They were wearing the hoop band to monitor sleep patterns. And a lot of these officers, they undergo a lot of stress and even to trauma from what they see. I mean, I can hardly imagine seeing a murder and some of the things that they see. And so it's over the top. And, they're expected to go into work the next day. And some of them don't do very well, under the stress, under the thing. And the last thing you want is somebody to be super stressed and can't sleep at night. And, that could come out in problems in marital stuff to, other problems, in the workplace and that. And what they found, they got the helmet. And this is I think it's about 2 months ago. And what they found out is that they had immediate improvement in the force with sleep patterns by using the helmet. A tremendous improvement in the sleep patterns, which they're absolutely thrilled with. The other thing that happened is it's kind of funny. All these officers, they're like always on the go. So when they're under the helmet, the technicians that are supposed to try and help the officers as well in their challenges, cognitive challenges or whatever is going on. Maybe not cognitive, but they're stress related things, and they're supposed to speak to the officers. Well, they'll only get like a 1 minute passing, of finding out something, so they don't get that time. Well, when they're under the helmet and they're feeling super relaxed, they end up talking about their issues. So their own department has improved dramatically in trying to get these officers to tell some of their deeper issues while they're under the helmet because they're
I love it.
relaxed and everything. So they're seeing this as a twofold thing that's going on that they know they can improve the officers' lives by using this light therapy, transcranial light therapy. And I do a demonstration where I show a real human helmet, real human skull, sorry. And with the red light, we're able to go right through the skull, like kind of like this. You see the red light going right through my hand there. And there's no problem for that light to go through the skull and reach the inner parts of the brain. The red light will come into the inner wall of the brain, so you'll increase blood flow. You'll do all those wonderful things on the inside wall of the brain but then taking it a step further, it will not only do that, but when we get into the near infrared wavelength, which in this case is either the 810 or we have the device here with the 1050 right here, the 810 or the 1050 near infrared wavelengths. You could, so I see this one red light, but you can see the purplish dots here. I can't see that at all here. Only the camera picks it up. But that wavelength or the other wavelength that I just showed everybody, this one here on this unit, can penetrate far deeper into the brain. And so that's why we can have the effect that we're having by getting the light in that deep. Red will be absorbed more by the blood flow, but hey, who cares if it gets absorbed by the blood because the blood is going to be carried much further. It's a systemic effect, so no problem being absorbed. But we like to use both wavelengths, and we're having beautiful results with both wavelengths. And the whole thing is, yes, there's red light helmets out there and all that kind of stuff, but I can tell you can tell the audience that this device is the most powerful helmet on the planet, because my background is 45 years electronics, so I know how to make things that are powerful and at the same time they're properly cooled so the electronics will last a long time. But that's what we've been able to do. And Wendy, you're seeing Dr. Bessler, sorry. I know you on a first name basis. Dr. Bessler, tell me what what other things are on your mind as far as what you've seen. Anything else?
Actually, I think you just touched on a point with the police department that I think viewers would love to know this. So we have numerous studies that actually show that photobiomodulation therapy, that nanometer spectrum, actually increases melatonin production by over 300%. That's one time, one exposure, one single exposure,
Okay.
over 300%.
So that neurosurgeon in Pittsburgh, he says he did the helmet, and he said, and he has trouble sleeping, and sleep patterns are rough, and he says, I don't know if it's a placebo effect or not, but I had the best sleep I've had in a long, long time. It's not
That
a
is
placebo effect. It's
Absolutely. That is very, very consistently. All of my patients notice that. And that's one of the biggest questions I ask. The other thing is, too, I think melatonin itself, we are so focused on melatonin as a sleep aid. But the funny thing is, only 25% of all of your melatonin is produced in the pineal gland, which has to do with sleep. So, where is the other 75%? Turns out the other 75% of your melatonin is actually produced by every single cell in your body, with the exception of a red blood cell. And it's not for sleep. It's because it's the largest anti-inflammatory your body has. We also now
really
know that, oh, yeah. And we know now that melatonin itself actually is also anti-cancer. It has the ability to actually kill off a cancer stem cell. I mean, so when we're talking about light and increasing melatonin production, I'm not just talking about getting a good night's sleep. I'm talking about reducing inflammation in the brain. And remember, just like you said, Tom, I don't have to get deep penetrance, it always cracks me up. I read some of these articles and they go, well, we've got to get deeper in the brain and we have to get the PBM deeper into the brain. Why? No, you don't. You have to get to a mitochondria. That's what I have to get to blood flow. I need to be deep enough that I'm going to hit blood flow, because where blood flow is, mitochondria live. And once you start that chain effect of starting that mitochondria onto the right pathway, now able to produce 36 ATP, that is going to spread everywhere. That's also why Dr. Nasser actually, I think, was part of these studies. They actually looked at Parkinson's disease. They used the PBM helmet, and they also used it just on the abdomen. And ironically enough, Parkinson's disease, they had improvements in these Parkinson's disease patients in their motor coordination, in their musculature. They had improvements regardless if it was on the head or on the stomach.
Yes, and then there's the whole area of we can't get into it, but the microbiome that's going on
Oh,
inside the gut and how light can help you increase the correct bacteria. It'll help produce more good bacteria and help the good bacteria win the war against the bad bacteria. And then
yes.
how the gut brain connection, as I'm learning, when I first started into this, I thought, oh, these guys are off the rocker. How is the gut ever connected to the brain? Well, my gosh, is it ever? And I mean, I've had to relearn, totally get cleaned up on a lot of thinking that I had some pretty dumb thinking
I
going
think
along.
we all did. Tom, I think medicine notorious for it. It's just over the last few years that they've talked about the gut microbiome. And we now know that your gut microbiome, those lovely bugs, are responsible for 90% of your serotonin and 50% of your dopamine production. It's amazing. It's
Uh,
amazing.
Here's another one that I learned about, I think it's about 6 months ago. They found out that the myelin and sheath actually form almost like a fiber optic. In other words, the light can travel along the myelin and sheath in your nerves. So I could never quite comprehend how you would put light on an acupuncture point and somehow it would have any effect. That didn't make any sense to me at all. But
Yeah.
now I understand if you manage to get the light right on the nerve bundle and get it right into the nerve fiber, that nerve fiber could end up traveling up to other parts of the body. It just to me it speaks over and over again of how wonderful our bodies are designed and the fact that we're still living with all the toxins that our bodies are still able to cope with all the barrages that we throw at it, and we still heal. We
Yeah.
still, things still work even when everything else is against it. It's amazing. So I know some people have picked this up, but I really believe that our bodies are so beautifully designed, so beautifully created. It just didn't come about by an accident in a junkyard. There's so much precision in anything you look in the body, and it all works so nicely together. And when you go and turn one thing out of place, oh my gosh, if you intervene somehow and you click that one thing in the wrong direction, you have the cancer, you have the diseases, you have all these things coming out of it just by changing one little thing. Well, how did the other 100 million right connections all come together at the right time? It's just like, no, I have a hard time believing that we came about by a couple billion years of accidents. It's just too
I'm with you. I'm with you. And when you think about it too, the human body is so amazing and is not in separate pieces. Unfortunately, in standardized medicine, we have become so specialized in different areas that nobody thinks, hey, wait a minute, the heart's connected to the brain's connected to your arm's connected to your gut. Everything has an interconnection. And if you change one thing, you're changing everything down the line. And you have to be cognizantly aware of that. And I always tell my patients, I actually had this framed and put on the wall. Physiology never lies. It will never lie to you. That is the most beautiful thing about the human body. Physiology, if you follow the physiology, you can figure out what's actually going on. If you
accurate.
follow the physiology of what PBM does, it's very clear.
Yeah.
It's very clear. We know it hits cytochrome C. We know exactly what it does and what it has the power to do. The frustrating part is that we're not all using it. We're not all using these different modalities that could really sincerely help our patients.
Yeah, yeah. And then
And
you
that's
start tying that into, what we're talking about here is not a little island. If you actually do really, really good food, that's going to have an effect. You're going to, how much does exercise have to play on it? And the exercise I get, unfortunately, you can tell somebody what they need to do, and they won't do it. I get my exercise in the airport when I land in Chicago, and we're sitting on the runway for 20 minutes while I'm looking at the 1 hour of time that I had between flights dwindle down, 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 and then realizing once I got into the airport that my flight, the gate that I'm supposed to be at, is on the opposite end of the airport. I'm running through the airport from one side to the other. So unfortunately, that's where I get some of my exercise. But I did make it on the flight. I was very thankful when I came back from Phoenix. It was like I was huffing and puffing by the time I got to the other end. I thought, but thankfully my body didn't complain too much. Nobody had to use one of the pads on me at the end of but uh, anyways, the number of times that I've used the light on other parts of my body. So I know we've been talking about the brain, but oh my gosh, anywhere in the body we can help the the different problems when it comes to inflammation, when we cause strain. So one of the strain is when I've got all this heavy electronics equipment, I have been able to localize it that I may get severe pain down my arm, and it happens later on, and I can hardly move my arm. And that's because I tried to drag all this luggage, and the things that happen, and you're trying to hang on to it all, and they don't have carts to go from one place to another. So all those things, and you're going in the bus and the tram and everything, and trying to lift it up here and there. And I've used the light and could barely move my arm, and the next day it's starting to move again, and 2 days later I got my full thing. But we've also experienced, on one of the flights to Dubai, the one chemical engineer, aviation engineer, he sat beside my friend, and we put the helmet on my friend in the airport. It's kind of funny. I've got to find it while I'm talking here. But what happened was, my friend, I wanted to do a light treatment on with the helmet, which would be the first time we've done it at 30,000 feet. Because we want to set the record on some of the stuff. Let me just see where that
Yeah.
picture is. It's coming up here. But anyways, the aviation engineer was sitting beside him, and he's kind of like, "What do you mean light's going to do anything?" Like, he was as skeptical as I remember right in the very beginning I was, and I says, "No, no, no, it really does help." I says, "Do you have any pain in your body?" And he's sitting beside my friend, and he said, "Yeah, my shoulder, I tore it up real bad." I says, "Okay, why don't you put this light on you, and I'll show you how it works." And so I'm just going to look for this. I got to find this picture because it is funny. There we go. Come on. It'll come. But
I
anyways,
know
so what
that.
happened is he put the palm light on his under on his arm like that, and it was about 15 minutes we were talking, and I said, as I said, he was extremely skeptical. And oh, here we go. So this is the one fellow that was using the light on his shoulder, and extremely skeptical. And about 15 minutes later, he's like, I says, "Okay, so do you notice any difference?" So he takes the light out, and he starts poking around. He says, "There's no pain right there. There's pain above it, there's pain below it, but there's no pain where I was treating." That was so funny. And that's the way some of us have to come along, kicking and screaming, that this would not. So this is a picture on the airplane, one fellow. You can see kind of the overhead compartment, and he's sitting side by side. And my friend here is getting a light treatment with the helmet at 30,000 feet. So that was a lot of fun. But in reality, they should have that on every flight. Can you imagine that in first class?
Absolutely,
Like,
yes. Because you actually helped us to develop the light over our hyperbaric. So we are now using PBM while I have a patient in our hyperbaric chamber
yeah,
at our
kind of the
office.
reverse.
Yep. It's literally very, very similar. And those responses, we're really excited because we're now starting to work with quite a few cancer patients as well. So we're
Mhm.
really excited about that. But even our traumatic brain injury patients, when you can do hyperbaric oxygen therapy with them, and at the same time, I can have that light therapy, it's an unbeatable combination. What we've seen with traumatic brain injuries is absolutely unbelievable, even 30 years after the injury.
Yeah. Yeah. Oh, yeah. I saw one person without hyperbarics, but just the transcranial PBM through the helmet um, had had a stroke and 20 years earlier and could not speak clearly. And one treatment, and the next day he was able to speak clearly after 20 years. And then he lost that ground again because he didn't continue to do the treatment. And I think he got back around later on. I got sometime I got to follow up, but such a dramatic improvement just even in one treatment. Do I say that one treatment's going to do it? No, I don't think so. Well, in some cases, there might be, but other times a person might need a period of time, whether it's a month or two, or they may need it for the rest of their life. And where we've also seen tinnitus or tinnitus improve dramatically. So there's all kinds of crazy stuff we've seen with this light and how it can help.
And I think that's the exciting thing. And again, those long-term effects, increasing brain-derived neurotrophic factor, we can see those long-term effects in these cases, and they continue to do better and better. And that's what we live for.
This is fantastic. Dr. Bessler, I want to thank you for coming on, but I'm wondering, we've got some questions here. Maybe, do you have a little bit more time to answer some of these
Sure.
questions?
Absolutely.
Okay. And I'll just say to the audience, even though we say we usually like, if you're going to have a ballot put in that you stay to the end, if you got time crunch and you have to leave, we usually say 8 o'clock is the end. 8 o'clock Eastern Standard Time is really where you need to be, as long as you need to be in to get that ballot put in. But anybody who has to go, that's fine. But we're going to answer some questions along the way here. And by the way, Gordon, if you want to type in your question and anybody into the chat area. So I see you got your hand raised. We were just mentioning that this can be regenerative, and that's what Dale picked up. What evidence has been found to rewire the brain, opening pathways to potentially restore sight post stroke? I don't know what that is. So are you familiar?
So it sounds like somebody that's actually had a stroke and then has lost their sight secondary to that. It sounds
Oh, I
like that's
see.
what they're
Okay,
explaining.
that probably makes sense. Yeah. Um,
Yeah.
that makes more sense. And I don't know, but go ahead if you have any thoughts on that.
So especially with stroke, for your listener, it actually depends upon where the stroke actually is located. If that stroke was in the occipital lobe, impairing vision, utilizing the PBM, the light therapy, specifically on the side of the stroke. Dr. Nasser made this very, very clear. You do not use it on both sides. You only use it on the side that has been impacted. It has the ability, again, to increase mitochondrial function, bringing oxygenated blood flow to a damaged area. In that area, there's something called a penumbrum that we worry about in neurology, which is where when the stroke happens, there's an area, a small area that's absolutely damaged, but then there's this area around it that actually has now had a decreased rate of blood flow. That area is possibly can come back if you increase blood flow into that area, but you have to do it very, very carefully and very appropriately. One of the easiest ways to do that actually is with transcranial PBM, because that is actually, I can target that area. Again, I can increase cerebral blood flow to that area, possibly restoring function. And again, this is not something that you would do just one time. This takes
Yeah.
literally time and time and time again. This is not a one and done.
And what I've learned come along to learn is it's not a bad idea to start slowly with some of these things and work your way to longer treatment times. Yeah. There's a question here by Sonar Kumar. He's how can PBM, palm or helmet, help patients who have experienced expressive aphasia, difficulty speaking, writing, typing, etc., after a moderate uh, stroke?
Okay, so expressive aphasia. So most likely that individual's stroke, unfortunately, usually happens on the left-hand side of the brain. So that's usually where most of the time when we're talking about expressive aphasia, there's different areas, Broca's and Wernicke's, areas that control our ability to express ourselves and to understand what is being said to us.
Mhm.
So those specific areas, again, that damaged area itself and whatever area around surrounding it that's been had less blood flow to it has the ability, if we do this correctly, has the ability to increase blood flow and possibly getting function back. Again, it's not, I'm not saying this is a cure.
And
I'm not saying this
everybody's
is a cure
so
of
different.
everything.
Everybody's so
Extremely.
different. And so for one person, it may help tremendously. Another person, it may, it just won't do anything. So, we've had the range, right, of different things. Now, one thing I know, and I'll just say it may be a little different because of my helmet, something, but I have been able to see a few people do extremely well. We don't have a lot of people coming through, and I'm looking for the day when we can have bigger studies to find out exactly. But we've had, my light is a full, all the way around the brain, and at some point in the future, we're also looking at making it so certain modules can be turned on. But we've had very good successes with some of these stroke issues by doing the whole brain. So, I mean, there's a lot of we got to learn. This is where, and so in that way, I might be a little bit disagreeing with you on one thing, but it's okay. We can but I don't know. I don't have enough knowledge. I would rather turn to you and Dr. Nasser, who've laid down a lot of groundwork. But for some reason, I've seen, and who knows, maybe it's because of the type of equipment that was used before that really did require a very focused type of light because otherwise you wouldn't get the effect that you want to get. Whereas I don't know. So but you know what? Don't believe me. Believe Dr. Bessler and yeah.
I
We have got some beautiful comments here that have been coming through. So amazing. Thank you so much. And let's see. Melody is asking, since the treatment heats the area, should we follow up the light treatment on of an inflamed knee with ice to help the inflammation? And here's something that I found is ice, although it's been around forever, you throw ice on the area, but in actual fact, yeah, you will notice that maybe there's a little more surging, when you're using the light. But ice actually slows down the metabolism in the area. And
Slows down.
so
Yeah. Yeah. Blood flow.
it's actually contrary to speeding up healing.
But
Um,
but ice is very, very good as an anti-inflammatory, just because exactly like you said, Tom, it's going to decrease because it's actually bringing down blood flow to the area, right?
Right.
So it's
But then at
actually
the same
decreasing because
time,
it's vasoconstricting.
yeah,
So that's where it can be helpful for inflammation, but it's not fixing anything. It's not, it's all it's doing is vasoconstricting. It's bringing down the inflammation in that area, which is fine and dandy. But if we actually want to have more of a fix, we're going to use something like PBM. And I would not necessarily use the PBM and then follow it with ice therapy. I would not, just
yeah,
because.
I have people that are just going PBM, forget about the ice
Mhm.
altogether. And just and they've had incredible results on the like I got some sports people like some real athletes. I mean, I can't talk about it because hey, the best I do is I push the mouse around once in a while and type on the keyboard. But I mean, there's some serious athletes that have been involved with our light therapy, and they don't use the ice now. They are using only the light in their workouts, and even when they injure themselves. So
Yeah,
it's
because you're using that light to increase blood flow, right? I'm
yeah,
actually increasing, I'm helping mitochondrial function. So if I'm doing that, I don't want to necessarily follow it with ice because I'm going to actually decrease blood flow temporarily to that area.
yeah,
So it's kind of contradicting what we're trying to do. Not
yeah,
that there's anything wrong with ice. I'm not saying that.
yeah,
And if that's all I have, that's all I'll use. But
yeah,
if I've
yeah.
got PBM, I'm going to use that.
So, Budawin, I'm sorry on some of these names. I'm probably mispronouncing them big time, but I'm sorry about that. But I'll try my best. I have a client with Parkinson's who has deep brain stimulation. Can she still use PBM? And if you have had 10 years of Parkinson's with Dr. Bessler, still expect improvements over time.
Okay, so deep brain stimulation is absolutely wonderful. I'm a huge advocate of DBS. I actually used to program DBS, and I will absolutely tell you, PBM, we can absolutely use PBM with a deep brain stimulator. There is no contraindication there at all. Again, because you're literally using a completely different physiologic system. When they're using that electricity, it's not going to interrupt that at all. And with somebody with Parkinson's disease for 10 years, I've had Parkinson's patients with Parkinson's that have had it for 20 and 30 years. And yes, you absolutely do get a response. It is very, very exciting to see that. And I will tell you this too, and you already know this, Tom, the vast majority of research that has been done on Parkinson's disease with PBM. And it's outstanding. It's
Yeah,
absolutely outstanding.
yeah, it's beautiful, beautiful. Donna is asking and this will probably be a question I answer, but who knows? Which version of the helmet power level goes right through? What is the actual effective difference in the least expensive helmet and the most expensive? Okay, how much more healing would be realized? Okay, I know, and I'll just say that we need more studies. Okay. The difference between the two helmets that I have the 660 810, and I believe you have the regular helmet, correct? The
Yep,
660 810.
you can.
And I had just started making the 1050 nanometer helmet. What we've seen is just I'd like to see a full out study comparing two side by side. But what was funny was, to show that maybe the 1050 might be, how much better is it? And I'm not about here to say it's 50% better, buy it. No, no, no. I don't have that knowledge behind me, but I can tell you that we've seen a little faster effect on some things. And one of them, very interesting, is my son-in-law, who's an industrial electrician, very sharp, and love him as a family member. He came with me on one of the when we went to one of the events, one of the conferences, and he said to me later on, he says, "Dad," he says, we had a line of people trying the helmets. Okay, so we had both of them going. We had the 660 810 and we had the 660 1050 unit running. And he says, "Do you know what I noticed?" And I says, "No." He says, "The people under the 1050, they would start to slouch and they'd yawn more."
Oh,
He says
interesting.
there was evident that he says, "Dad, no doubt in my mind, they would end up yawning." I'm thinking about it now, and I'm almost ready to yawn here. But he says, I don't know so it might, if we did some more extensive stuff, we could see what does the brain waves look like? How does that change? And more recently, if anybody wants to look back a few episodes, we got an Alex Nye. We did a live presentation with an EEG machine, go like where you put the probes on the brain, and we were able to watch the change of the brain waves just in a couple minutes under the helmet live. So, it was amazing. We saw the heart rate variability. So there's a measurement for your heart rate variability. We are able to see the heart rate variability increase. We are able to see you could explain it better than I, but what were the things, the relaxation mode, beta, delta, um,
Alpha and beta.
yeah,
Yeah.
so he said that, one thing went way up in the
I
low
think it was your
frequency.
beta.
That's the
Yeah.
beta. Okay. And then some of the other things went way down. What's those?
So
Sorry.
alpha.
Alpha.
Or again, so beta is more stimulating. So you and I right now, our beta is high. We're presenting information, things like that. So your beta will actually go up when you're kind of on. And alpha can be more in the background, more soothing, kind of when I'm more calm. I can study, I can do more calming things underneath that. So there's quite a few. And then there's also when you're asleep, there are some additional waves that are actually
Okay. All
utilized.
right. Well, anyways, people can watch the webinar and they can see it in real time. They see the changes of the brain in just a couple minutes. It was amazing to see. Let's see. So I would say that from what we're seeing, the 1050 might have a little bit extra effect. But both whether you have the funds or you don't have the funds, don't have to go there to spend more to get results. As Dr. Bessler has the 66810, and it works beautiful. And but if you want to, if funds are not a problem, you might get a little bit more out of the 1050. That's all. Like until we get a bigger study. I can't prove it beyond a shadow of doubt, but that's just we're seeing with both helmets really good results. Tamara said, "God is light." Yep, he
Yeah.
created light in the first place, and I'm just using a tiny bit of it out of that whole spectrum that you see when the rainbow occurs. I'm just down in the red spectrum, and that's the spectrum that actually penetrates. Red penetrates, near infrared penetrates even more when it's 810 or 1050. So Dina's commenting, wow, this interview with Dr. Bessler is so encouraging, absolutely wonderful. Thank you so much for this XOXOX. I am so encouraged to continue using PBM and know that there is no side effects. Just love it. Much love to you and the team.
Oh,
That's
so nice. So
yeah,
nice.
yeah. So Denise is asking, have you ever considered making red light slippers for sore feet and to increase the blood flow? Okay, all right. That's
That's your
products.
next job.
Yeah, yeah. I have the next one that we want to really get into is to do with more of the oral health side of things.
Mm.
We've been working on that already for the past year, and so yeah, there. I don't know about slippers, but anyway, so, thank you for your questions. And you know what? Sometimes these questions pose a thought, and never know when maybe a year from now there's some slippers on the market. I don't know. Um, Rena, where should I be using the Palm Light to treat chronic fatigue 4 years post-COVID? Um, Go ahead. Your thoughts? And yes, there's been research that shows that you can improve long COVID symptoms,
Yeah,
chronic fatigue.
especially the brain fog that comes with that, which can
Yeah.
be absolutely devastating to many, many patients. So when it comes to that, I would suggest actually the head. I think we're going to get the most bang for our buck utilizing that area. And if we're going to look specifically what portion of the head, I would actually do frontal lobe.
Okay.
That's where I would focus that light therapy.
Okay.
That's where I think we're going to get the most.
Okay. Whoa. I just looked down. There's 41 questions. We'll be here till midnight. You know what? I'm just gonna have to ask people. We're gonna just wrap it up here in the next few minutes, but I'm just gonna roll through these quickly. Russ is saying thanks, Tom, for having great guests on your show. And Dawn is saying, how do I enter my ballot? As soon as you watch, we pick up your email and you're entered in the thing. If Jonathan's asking if light is reaching the blood, then why not just target the neck? Hey, no problem. Neck is a lot of blood flow. You can do that, and it'll affect a lot of things that way. Also
Actually,
help your thyroid too.
absolutely, and vagal. So there's a lot of vagus stimulation too that
Okay.
actually can help significantly with utilizing that neck area.
Okay. Tamara's, how much time for each light level? How much time okay. This is really something dependent on where you're treating on the body. So somebody might treat their fingers for 1 minute of red, 1 minute of near infrared, but if they're going to treat their hip, they're going to be looking at like 5 minutes of red and maybe 10 minutes of near infrared or more. We haven't had really problems with overdosing with light, but I will say that if you're above the neckline, and you're trying to work on parts of your brain and eyes and everything, that's where you really take it slow and steady for what you want to do. And don't start off. And it's kind of like a pendulum. Think of a pendulum. You pull it all the way one way. And then if you go and take one huge dose, it's like totally releasing the thing. And it's like you're going to get some swinging that's going to occur. It's a little easier to do just a little bit more, a little bit more PBM, a little bit more PBM, and then you get just a little tiny, kind of changes. So that's, and you know what I say, we're seeing some extremely good results with people doing it several times a day. No problem with that. And unlike some of the other stuff with PBM where you're using a laser and you're using a very high amount of energy and you could overdose the tissue in that area, we don't have that. Oops, sorry, you move things around. I'm going to go very, very quickly through these. Yvonne, thank you for a wonderful discussion. Thank you for your comments. Can it help with OCD?
Yes, yes.
Yeah,
OCD is
yeah.
one of my very favorite things.
Okay, yeah. Dr. Bessler mentioned just 12-week sweet spot therapy session. What's her recommendation dosages for any speech impairment as a result from strokes? What do you think?
Again, going to that 3 month, that 12 weeks, utilizing that. Usually right now, most of the studies are based with stroke upon a 12-week time frame and anywhere from 3 to 5 times a week
There you
during
go.
that time frame.
Yeah, yeah.
So I
And you
would
can use the palm for that type of
Mhm.
treatment. You don't necessarily have to go with the helmet. A helmet's nice
Yes.
because it does cover a whole area, but again, if you're trying to localize treat things, you got the palm and you can do it. Thank you for that. Okay. Okay, we covered that. We covered that. We covered that. Um, Okay, Karen's asking about lymphatics. We have a diagram for lymphatics. Follow that diagram. It'll teach you a lot. You really, that's a whole nother lecture. We've done a lecture on or a podcast on lymphatics. So, yeah. Uh, Bridget is asking, how about thalmatic arrhythmia? I don't know if you want to.
I'm sorry, I didn't hear that.
Thalmatic arrhythmia?
So specifically the thalamus?
Yeah, I don't know. We don't have enough information. Email us the questions. Okay, and there's still some more. Okay, here's one more. Wow, this is the longest podcast we've had in a long time. And you know what? I'll for all those that are watching here, I'll just say we still have 90% of the people still watching that were with us the whole show. That's got to be something right there to say how many people hung in to watch right down to the end here. And,
I appreciate that.
Dr. Bessler, you've really opened the minds for a lot of people here. There's one question from Emily here. My daughter has polymyalgia affecting her entire right hemisphere of her brain. Because of this, she has focal epilepsy with D-SWAS along with left-sided cerebral palsy. She's 8. Do you think this would help if you applied it to the right hemisphere?
Yes. And that one's really important. It has to be applied to the appropriate hemisphere that the issue is actually occurring on.
Okay.
Really, really
And that's the
important.
easiest with the palm.
Yes, yes, 100%. And that could be, again, we're increasing cerebral blood flow to that area. So we can hopefully, we can get an increase in mitochondrial production, increase in ATP, and we can do a more free radical damage cleanup.
Okay. Uh, okay. Donna, we did cover that kind of with what would be okay, well, yeah, what would be the harm is in doing the entire brain? Just
There's
sometimes,
there's
yeah,
There's
go.
no harm. There's no harm in doing the entire brain. The only because Dr. Nassar can also obviously is the guru of this, but she noted in many of her studies that when we had a stroke or a specific issue, that one side of the brain that we did not get when we did the whole entire brain, we did not get the good response that we were looking for as when we just did the area that was affected by the stroke, we got a much better response with PBM.
And that again was with different equipment. So,
Yes, yes, it was.
again, this may be different than the results we're getting. I'm not poo-pooing this
Right.
information.
But
I'm
we
just
can
saying,
only speak to those
yeah,
research studies.
yeah,
Yeah.
that's right. That's right. Um, Margaret is mentioning, I've published a paper using TPBM with aphasia to improve speech and naming. It is likely on the SunPower LED website. Yes, it is. It's on the SunPower LED website under PBM 2024. Nasser Ho Martin et al. Around 2020. But if you person goes to PBM 2024, where you and I met first time in 2024, you can see her presentation. Yeah, and you know what? For the rest of this, we have gone a long time. There's a lot of people giving thanks. Please email us the questions to info@SunPowerLED. And also, if you want to be able to share this with your friends, please go to our YouTube channel, like and subscribe and like. And as soon as we have this video up with Dr. Bessler, you will be the first to know within seconds when we put it up there. So please like and subscribe if you haven't done that already. And Dr. Bessler, thank you so much from the bottom of my heart. I thank you for all that you're doing. You're helping a lot of people.
Thank you so much, Tom. That means the world to me and to everyone else. Thank you so much for listening to me rave on about this stuff, but it's an exciting part of medicine. I'm just so incredibly privileged to be part of it.
Thank you. And everybody tune into our next webinar next Tuesday I'm not sure exactly what it'll be right now, but I'm sure you'll enjoy it. And I wish everyone God's richest blessings. Thank you for being on tonight, Dr. Bessler. Thank you.
Thank you
Thank you.
so
Thank you.
much.
Thank you.
Thanks, Tom.
All right. Okay. Bye for now.
Bye.